All right, good afternoon. Thank you for joining us for our monthly CivEx webinar. We appreciate all of you taking the time to be a part of this important conversation. Today, we will hear from a panel of experts on the front lines of the state government's ongoing response to the COVID-19 pandemic, who all happen to be Flinn-Brown Fellows. We hope that you will learn about their involvement in responding to the pandemic, their challenges, their experiences, and their outlook for future response and recovery plans. I'm very happy to introduce Daniel Ruiz, the moderator for today's discussion, who is not only a Flinn-Brown Fellow, but also a former colleague of mine from the Governor's Office. Daniel serves as the Chief of Operations in the Governor's Office, overseeing cabinet agencies, cabinet directors, agency performance management, and operations. Daniel's influence in the Governor's Office is wide and spans from policy to operations to communications. This is evident in his prior roles, including advisor to the Governor for communications and policy strategy, agency affairs, elections policy, and as Director of Media Affairs. Prior to joining the Governor's team, Daniel worked at the Maricopa County Recorder's Office and at the Citizens Clean Elections Commission. And for our Flinn-Brown Fellows in 2018, Daniel was the recipient of the Jack Jewett Award for his commitment to the long-term success of our great state of Arizona. Daniel?
Thank you, Dawn, for the kind introduction. And I also want to thank the Flinn Foundation and the Arizona Center for Civic Leadership for hosting this panel today. The panel today is titled Arizona's COVID-19 Ongoing Response and Recovery on the Front Lines with Flinn-Brown Fellows in State Government. And I've seen the RSVP list for today's CivEx session, and I know that so many of the participants today are Flinn-Brown Fellows. And to all of you, I just want to say thank you for your continued service and support to our state. And I also want to say I miss you very much, and I can't wait until the days we can all meet together in person, preferably over a glass or 2 or 3 of wine. I know that that's going to be a lot of fun, and I can't wait till that happens. For those who are joining us and not Flinn-Brown Fellows, just a little background. This program was developed to foster civic leaders in Arizona, build knowledge, skills, and create a robust network to find solutions for Arizona's long-term issues. I'm joined today by a few key members of that network who have really been on the front lines of the state's response to COVID-19. To start, each of our panelists will introduce themselves, tell you a little bit about their roles, and the impact that COVID-19 has had on their responsibility. We're going to start today in alphabetical order with introductions, starting with Ben Blink with the Governor's Office.
Hey, thanks so much, Daniel. My name is Ben Blink. I'm a Flinn-Brown Fellow from 2018 when I was a member of the Governor's Budget Office. I'm a policy advisor for transportation and technology, innovation, and economic affairs for the Governor. And Daniel, do you want me to go for the 5 minutes now, or do you just want to do introductions first?
Just introductions for now, and then we'll turn it over to you.
Good.
Thanks, Ben. Next, we'll head to hear from Sarah Pirzada for her introduction.
Hi, Daniel. Thank you. Hi, everyone. So good to see you all. Well, I guess I can't see you, but good to know you're there. I am currently the Deputy COO in the Governor's Office. So Daniel is my boss and he's great. And I've been in the Governor's Office for 4 years and spent the first 2 years in the Budget Office. So have a special place in my heart there. But currently in my role, I focus on operations and I also oversee the Government Transformation Office. Thank you.
Thank you, Sarah, and thank you for making my job so much easier. Next, we'll hear from Jessica Rigler.
Hi, everyone, and welcome. So glad to hear from you all this afternoon. I'm Jessica. I'm a 2019 Flinn-Brown Fellow, and I'm currently an Assistant Director at the Arizona Department of Health Services. I've been here for 12 years and in public health for 16. But in my current role as Assistant Director, I started that about 2 years ago. I oversee our Division of Public Health Preparedness. It's about a 260 staff person division that includes our state public health laboratory, public health statistics, our emergency medical services and trauma systems, our Bureau of Emergency Public Health Preparedness, and then our Epidemiology and Disease Control Bureau that includes all of our infectious diseases, environmental health, and immunizations. Thank you.
Thank you, Jessica. And now we'll hear from Richie Taylor, who I believe is the newest Flinn-Brown Fellow on the panel.
Thanks, Daniel. Yes, I'm actually a current Flinn-Brown cohort member this year. I'm the communications director for the Arizona Department of Education and Superintendent Hoffman. Prior to this, I've worked in the mayor's office in New York City, as well as Maricopa County, doing communications work. And I'm excited to be here today. Thank you.
Thanks, Richie. And finally, we'll hear from Alec Esteban Thompson, who works in the governor's office.
Thanks, Daniel. Yeah, I have been with the governor's office now 3 years. I have the pleasure of running strategic campaigns for the office, including some COVID-related stuff and most recently census. But I have a long background in Arizona politics as well as national politics, working for the Human Rights Campaign. So I'm really glad to be here and sharing this panel with some friends.
Well, thank you all for joining on today's panel. I know that everyone here has a lot of other duties that they're tending to throughout the day, and so taking out a bit of carving out a bit of your day for this is really appreciated. And I really look forward to hearing your firsthand accounts about life in public service during a global pandemic. I want to just start by telling you a little bit about my responsibilities, my experience in the pandemic, some of the things that I've witnessed that have really made me proud of the public servants in state government and across the public sector. I want to tell you a little bit about the ways that we've transformed state government and what I've seen about the importance of relationships and even the Flinn-Brown network in some of the events that we've had the opportunity to participate in this year. And what a year it's been. I was asked by the governor earlier this year to serve as COO for the state, and I was honored. I've been in public service my entire career, and he really pitched it as an opportunity to lead the second largest workforce in the state and advocate for employee-driven solutions in state government. And what an honor that was to be asked. And about 20 days after the announcement of me taking the position of COO was made, we had our very first case of COVID-19. So announcement made on January 6th. The very first case of COVID-19 announced on January 26th. And 20 days later, the job description changed completely. It was obviously it was a little bit of a learning experience, but it was more of an experience in seeing firsthand what can be done when you have a workforce built of people that are dedicated to serving the citizens of our state and ensuring that government is operating efficiently for the people that pay our paychecks. We are public servants, and we want to make sure that government is serving them. The governor asked me to be a leader of leaders and to empower the experts that lead our agencies and ensure accountability. And what a great team of leaders it is, whether it's Dr. Kara Christ at our Arizona Department of Health Services, Major General Mick McGuire at the Arizona National Guard, Colonel Heston Silbert at the Department of Public Safety. There are so many people who have put in so many hours and so much time and so much commitment to serving the people of our state, and I am so grateful for their service. So just a little bit of background, January 26th, very first case of COVID-19. A day later, the Arizona Department of Health Services activated the State Health Emergency Operations Center. The governor declared a public health emergency on March 11th, and at that time, we had 9 confirmed cases. The decisions that followed were among the most difficult we've made during the governor's term. Decisions to issue a stay-at-home order, to close schools, to limit visitations in congregate settings, in places where they're needed most, our veterans' homes, and our prisons. These were difficult decisions to make, and they had an impact on so many. We had a lot of calls to increase mitigation measures, close down restaurants, limit capacity in these businesses. We knew that we wanted to take an approach that was responsible, that would ensure that we were making an effort to slow the spread and that we were seeing impacts to slow the spread. But we also had to be aware of the public health as a whole. the impact of financial straits that would be placed on our citizens who would be put out of work. These are not decisions that were made easy, and they were made really with the compassion and the dedication of the people in state government, working around the clock to figure out how we could minimize the impacts of those decisions on people. And while all this played out publicly and in political circles, behind the scenes, what I got to see firsthand was the real leadership and service that makes the state so impressive. As I mentioned before, the state has multiple congregate care settings across state government. To name a few, the Department of Corrections, Recidivism and Reentry, the Department of Veterans Services has veterans homes, the Department of Child Safety, the Department of Economic Security, the State Pioneers Home. We had to transform our operations at every single one of these congregate settings. And it was the hard work of state employees and public servants and civic leaders that made that possible. We knew we had to protect our workforce, and we wanted to try and encourage virtual work in Arizona. But if we were going to do that in the private sector, we had to lead from the government sector. We had to lead by example. And our agencies did just that, with the number of employees working remotely in state agencies varying from 40% to 75%, depending on the agency. We solicited ideas from government employees and agency directors on how to ensure elderly citizens and our most vulnerable were protected. And agencies like ADOT and DEQ delivered, extending license expiration dates for those who needed it most, ensuring that people wouldn't have to come into our government buildings if they didn't need to. They could stay home. We knew they were safer at home. With 3 statewide elections, we worked to ensure that polling places had access to sanitary materials they needed. We have early voting. We have a lot of high participation in early voting, but we also have a lot of people that like to come to the polls, and we wanted to make sure that no one was disenfranchised. So we asked our state employees to step up to the plate, give the senior citizens and the elderly that so often work the polls the day off, and ensure that people could contribute to state service in a different way that day without taking their personal leave or their vacation leave. We also transformed entire state buildings into polling places. These are things that happen behind the scenes that we don't really hear about, but can only be done thanks to those dedicated public servants. We also wanted to make sure that we had access to the materials to protect our employees that had to come into the office. In April, when the CDC recommended fabric face coverings be worn, we knew we had to provide them to our state employees. It's leaders like Sarah Pirzada, my deputy, who you've all met, that worked to make sure that within a few days, we were able to get every public sector employee in state government fabric face coverings. And this was at a time when supplies were low. It wasn't easy to buy a fabric face covering back in April like it is today. The professionals of the Department of Health Services, they've worked around the clock from analyzing the public health data that we review every day, the hospital data, enforcing the mitigation requirements on businesses across the state, and leading the operations of our Health Emergency Operations Center. We've also got the Department of Economic Security, who've had to deal with the tremendous workload to ensure that Arizonans were getting the benefits they needed. And we had to increase our workforce in that department virtually, with all of our offices, with the majority of our offices in that department being closed. The idea that we were able to solicit thousands of employees and train them to get these services to Arizonans is unprecedented. And it's something that we've shared with the private sector. It's something they've marveled at. It's something that they were not faced with doing. They have not been faced with doing. And they were really impressed at the efforts of our state agencies. There have also been a few events that encapsulated the importance of professional networks like this. In June, Dr. Birx from the White House Coronavirus Task Force visited the state, and she asked that we meet with community leaders. Organically, I looked around the table at some of the participants, and there were a wealth of Flinn-Brown fellows, people in this network that I could immediately approach because we had that connection. We had that commitment to public service, and we were able to foster partnerships from there. We were also able to do things for the citizens of Arizona when they needed it most. When the superintendent of public instruction and the governor announced that schools were closing earlier this year, we knew that critical employees, doctors, nurses, healthcare workers needed access to childcare. If their kids weren't in school, and at that time the majority of the childcare settings were closed, we wanted to make sure that we had an opportunity for them to go to work and send their kids someplace safe. And it's work of leaders like Leela Wendell, who's a Flinn-Brown Fellow and works at the Department of Economic Security, Sarah Pizzata in our office, and Richie Taylor, who's on this panel, all worked to ensure that they had access to childcare through Arizona Enrichment Centers. That was done because there was a connection, because there was an established relationship, because we were all part of that same network and we all had that same commitment to service. I think it really exemplifies the importance of organizations like the Flinn Foundation and the importance of leadership academies like the Arizona Center for Civic Leadership. This is a way for us to really ensure that Arizona has a wealth of talent across public service in our state, and that we have every asset and every resource directed to serving the people of our state. So that's a little bit of a background, a summary of the things that I've seen as a COO of state government that make me so proud of our state's workforce. I want to turn it over to Jessica Rigler, who really has been on the front lines. She's the Assistant Director at the Arizona Department of Health Services, and she's going to tell you about how COVID-19 has impacted her job and some of the things that she's seen in her experience over the last year. Jessica?
Thank you so much, Daniel. Yeah, so the impact of COVID-19 on the public health system and more broadly on the public's health has been unprecedented, as I know all of you know. And for me personally, for my colleagues, we continue to grapple with our mission to serve the greater health of the public, with the physical and the emotional toll that a response of this magnitude has had on us and our families and our coworkers. It's really been a significant challenge, and I'm so proud of our teams for continuing to persevere every single day. We're always weighing these immediate impacts of disease transmission with the longer-term consequences of the pandemic, which, as we know, are negative impacts on the social determinants of health that can result from economic impacts of this pandemic, and the impediments to educational attainment of our children, which we know impact health down the road. We're seeing rising reports of drug overdose, suicide, mental health concerns, loneliness, and adverse childhood experiences. So while we continue to battle COVID on a daily basis, we're also looking ahead to what public health will be called to do once the immediate threat of disease is behind us. And it's that context in which we formulate all of our response priorities. As Daniel mentioned, Arizona had one of the first cases of COVID-19 in the US. That was before it was even called COVID-19, back in January. And from that time and our launch of the Health Emergency Operations Center, and we've been moving forward in order to do the best we can to serve the Arizona citizens and our public. And like all of my fellow Flinn-Brown fellows know, the greatest chances of success happen when we're able to mobilize our efforts across partners, as Daniel's mentioned, which we've been doing since the beginning of this pandemic. It's really critical to have those connections and partnerships in order to move these large initiatives forward that we need in order to respond to situations such as this. In the early days of our response, we didn't know very much about the disease. We were constantly learning all the time, getting intel from international. And we focused on where we knew we could have the biggest impact. That included sharing as much information as we had broadly with numerous stakeholder groups through webinar series and other types of information, and putting together and providing playbooks to local public health departments who are the boots on the ground responders. That includes dusting off all of our response plans, reviewing rule and statute, and identifying where our authorities lie to take certain actions. We activated our warehouse so we could purchase, receive, and distribute personal protective equipment, which, as y'all remember, was quickly in short supply early in this pandemic. We readied our state laboratories so that we could begin testing as soon as an approved test was available, which took a while in the beginning. And we enhanced all of our surveillance and reporting systems so we could collect COVID-19 reports from healthcare providers and labs in order to provide as much real-time data and situational awareness as possible to the public and our response partners. And of course, no doubt, I could use this entire time just to talk about the public health response to date, which I'm not going to do. I just wanted to highlight for all of you the biggest and most transformative initiatives that we've undertaken through state public health, which I hope that you'll see have been undertaken very closely in partnership with other state and local agencies, with our healthcare and community partners, and a multidisciplinary group of stakeholders that continues to grow. Really throughout this response, we've just added more and more partners that have been critical in order for us to achieve success in protecting Arizona's health. Early on, we expanded our data and surveillance systems, which was buoyed by enhanced surveillance advisories issued by Governor Ducey under our public health emergency statutes. And that really allowed us to provide a better picture of COVID-19 case rates, demographics, testing patterns, healthcare utilization, all real time through our daily dashboards that I'm sure many of you are very familiar with. We've also distributed more than 50 million pieces of PPE and cleaning and sanitizing supplies since January that we've acquired through donations and federal support and purchases. We allocate those supplies to the county and tribal health departments, and then they further get them out through their jurisdictions. And I'll tell you, this is something of a scale we've never done before. I know more about warehousing operations now than we ever did, and we've been exercising for some supplies to be coming into the state for quite some time, but never, ever of this magnitude. Once approved COVID-19 tests were available, we also began supporting the implementation of testing throughout the state, first at our state laboratory. But early on, testing wasn't widely available. The supply chain was stretched. There were long wait times at testing sites. And so we tried to think about the best ways we could approach that problem to provide better access to testing in Arizona, and issued a call to action through the healthcare community by offering some incentives for additional providers to begin standing up drive-through testing in the community on weekends in May, and trying to identify those community hotspots where there was a lack of access to testing but disease circulating that we really wanted to target. These efforts early on kickstarted widespread community testing across the state, which only expanded from there. And it's been incredible just to see the community kind of rise up to start offering the testing, and community-based organizations working together in partnership with the state and the locals in order to offer small-scale and large-scale testing sites, partnerships from the community colleges to provide their campuses for use for some of these sites. It really is a whole community effort. Another concern that we addressed early on was preserving the health of our healthcare system, which, as you know, is critical and continues to be so. I'm sure you all recall watching with concern early in this pandemic as New York's hospitals were overwhelmed. We did as well, and we quickly put plans in place to prevent something similar in Arizona. I remember just sitting around a conference table on a Saturday thinking about what we could do that had never been done before that would help prevent something like what we saw in New York. And what that led to was the launch of the Arizona Surge Line, a system that we facilitate at ADHS, and it's driven by the collaboration of all Arizona hospitals. That's large and small hospitals, rural and urban hospitals, tribal hospitals, are all participants and crucial to making this system work. And the Surge Line facilitates the transfer of COVID-19 patients from higher or lower levels of care by expediting the identification of an open bed in the state at a facility with the resources to provide the right level of care to a patient who needs it. So what that does is really ensure that any hospitals that are overwhelmed have a way to get their patients to the care they need, so that every Arizonan can receive the right level of care no matter where they live or how big or small their hospital is. In addition, we leaned in so we could cover the cost of patient transfer if that was a concern, and the repatriation of patients back to where they came from if they had to be transported out of their regional area. And we've got an executive order in place that requires all that care to be provided at an in-network rate for patients. We've transferred over 3,300 patients through the Arizona Surge Line to date, and this has become a national model that many states are trying to mimic at this time. But that was some great innovation by our teams in order to set something like that up that could be that safety net for the Arizona public and our hospital systems. The Surge Line eventually branched out to support other aspects of the Arizona healthcare system. That includes assisting with the discharge, so helping facilities identify post-acute care beds that are available that will accept COVID-19 patients, so hospitals can free up their beds more rapidly to take in additional acute care inpatients. We also pay to hold beds open at post-acute care facilities around the state so we can place patients who are ready for discharge but not yet ready to go home. And we've worked really hard to contract with a nurse staffing agency. Over the summer, we were able to provide about 500 nurses from out of state to hospitals throughout Arizona to buoy their staffing and support their ability to maintain patient care. And in partnership with the governor's office, we've recently further expanded the staffing effort in recent weeks, granting $25 million to the largest Arizona hospital systems for staffing support, and are in the process of contracting for about 300 traveling nurses as well to support Arizona's rural and regional hospitals. But that collaboration across the healthcare system has been unprecedented in Arizona, and we're just thrilled to be working with those healthcare partners to make this a success. And then finally, we're planning for vaccine distribution and administration. This has been ongoing since the spring. We have a task force put together, so we've got voices from our community-based organizations and healthcare partners, and that continues to expand. We actually outgrew our 200-person seat in Google Meets for our meetings for the task force, and so we had to move to a larger platform. But we feel really blessed to just have that participation from the full community so that we're doing all-inclusive community planning for this vaccine distribution effort. And I'll just say, parallel to our disease response work, we're continuing to address other public health impacts of COVID-19, as I mentioned earlier, including impacts of the social determinants of health. So our WIC and home visiting programs have identified options to provide online services. Telehealth programs have expanded. Our school health programs are working in partnership with Department of Education and the USDA to identify nutritional options for students who are virtually learning. And we've partnered with other state agencies, the Arizona Medical Association and others, to implement programs to support mental health impacts of the pandemic as well. And then we're rolling out a new component of the Arizona Health Improvement Plan, which is a plan that we've collaboratively developed with multiple partners. We previously had 4 priorities to this plan. Those were focus areas on health equity, health in all policies, mental well-being, and the health of rural and urban underserved communities. But we're in the process of building out a 5th priority area to focus on pandemic recovery, which will require collaboration across multiple partners for years to come. So I'll just plant a bug in your ear now if that's something you're interested in participating in, and please reach out and we'll get you looped into the planning for that. I'll just close by saying that the scale of this work is overwhelming. And I said that in the beginning too. There's media stories and public discourse that focus on the decisions of policymakers, but the being on the ground in state service, we're working with a dedicated team of career public health professionals. These are folks that have been working overtime, no exaggeration, for the last 48 weeks and counting, so that we can just do the best we can to support the health of everyone in Arizona. And we're all here because of this passion for health, our dedication to serve Arizonans, and that's a purpose I know is shared by this entire Flinn-Brown network. So I'm thankful for the continued support and dedication of all of our partners out there and our public health teams as we continue to get through this response. Thank you.
Thank you, Jessica. And I've seen Jessica work around the clock firsthand, rarely with a day off, including the weekends, and working through the night so frequently. So I just think it's important to recognize that the amount of service and the amount of time that folks are putting into this COVID-19 response. Jessica mentioned the surge line, and I really think that's an illustration of how innovative the state has been in the COVID-19 response. And it's been because of young professionals like Jessica that bring a new perspective to the table. There was actually a Cuomo press conference where he said he wishes he had a system like the surge line in New York. And I think they've since implemented something similar. That system really has been a model in terms of the response. And it's just another example of the way that our state has transformed operations. Someone who's been at the forefront of that effort and really facilitated that transformation is Sarah Pirzada, who serves as the Deputy Chief Operating Officer and is also the Director of the Government Transformation Office. And now we'll hear Sarah's story.
Awesome. Thank you so much, Daniel. And I often describe my role and my job because it's sometimes really hard to tell people what exactly it is I do every day because it's so different day to day, even before the pandemic. And one of the reasons that I love my job, and it's the best job in state government, I'll often say my job is a fellowship in leadership. I'm constantly working with leaders that have various expertise, usually a full career background in whatever it is that they work in, whether that's corrections or health or environmental quality. And so I really get to see those leadership behaviors across the state day in and day out. And 2020 has no doubt been a great stress test of leadership everywhere, no matter what sector you work in. It has been a challenge as we've faced unforeseen challenges and rapid change and uncertainty. And I know there was a moment when, I think no one really knew at the beginning of the pandemic how serious or impactful it would be up front. And there was a moment when, somebody whose career is probably as long as my lifespan said, this is really the going to be the challenge that makes our careers and the challenge of our time. And so for them to say that really made me sit up and pay attention. And so it has been a real honor, I think, to sit in this role and to watch the amazing, I think, service and leadership across the state And I think that probably everyone on the call, anyone who works in the public service sector, has a lot of stories to tell. And I agree with Daniel. I hope one day we can all sit down and share those together. You know, something in government that I think makes it even more difficult is that a slight hiccup due to these changes in productivity has much larger implications than just the company's bottom line. It will directly impact the health and welfare of the people that we serve, often the most vulnerable and those that are most in need at this time. And I can 100% attest to the fact that state employees have stepped up to meet this challenge. I have 3 examples I'm going to share, but I could go on and on and on, and I'm going to try really hard not to do that. There's so many stories that I think by the end of this, we'd have a book to write. The first I want to talk about is probably very similar to something that you've all experienced, and that's the rapid transformation of where we do work. So this is a common story, again, without compromising quality or efficiency of services. So overnight, the workplace suddenly became the greatest risk to business operations and continuity for state employees. And so in order to keep our customers safe, to be able to continue providing service and keep our staff safe, the best thing that we could do was move as many of people home or to work remotely as possible. So to give you a sense of scale, the state has over 33,000 full-time employees, over 100 different lines of business, which is about 120 agencies. About 36 of those are cabinet agencies. So a huge enterprise of impact. In February of 2020, we had just over 2,000 employees remote working in the entire state. So this posed a huge challenge to managers to say, okay, how do you manage someone in a remote environment? And also from an IT standpoint, because everyone was going through this transformation, the supply chain was very limited. And then all of a sudden you had cybersecurity issues and considerations that you'd never had before, just because of the scale of the transformation. And obviously, as a state, we have to be very diligent and cautious about the data that we're working with. However, in mid-May, we had over 15,000 employees remote working. So, and over 1 million hours per pay period logged as remote work. And that, I think, is a huge success for us, especially when you consider that many jobs in state government, we can never transition to remote work, like those who work in our state hospital, our correctional system, et cetera. And something that I see as a really big win from this, and something I think Daniel and leadership made really clear, I said, we will not compromise the quality of our service, the performance and our outcomes as a state when we make this transition. And so leadership worked really hard to make sure that we were still delivering to our customers through this transition. And when we did the state employee engagement survey in the fall, which is an annual survey we do to see, okay, how engaged are state employees, we saw a huge increase from 70 to 74%. So 4% increase over a workforce of 33,000 is significant and surprising, honestly, given the current environment. The fact that people are even more engaged today than they were a year ago, I just think speaks to the true public service that drives people in civic duty roles. I also have heard from a lot of leaders, attributing the success that we've seen because of the governor's focus over the last few years on performance management through the Arizona management system, on leaders who lead and manage performance over presence, who were encouraging and helping staff to solve problems at every level of state government. That's a critical skill set that we need for this transition to be successful. And so now we have a program moving forward to see how do we capture sustainable remote work in what will be the new normal beyond the pandemic. We already see this as a benefit to employees, and I'm sure, as you can see, is something that a lot of private companies are considering as well. So I'll shift to the second story that I wanted to share was in April, when we got a call that said, hey, the CDC is updating their guidance. They're now recommending that everyone wear a fabric face covering. And as Daniel mentioned at that time, that this was even before there was the videos of like how to fold a t-shirt into a mask. The supply chain went berserk because there really wasn't anything available locally. So it was about 4 weeks out to get anything internationally, especially for a large organization like the state of Arizona. And with COVID, there were impacts also to that, so even the international shipping. And so we said, okay, we want our employees to be safe. We want our clients to be safe. How do we get them masks as soon as possible? And so we had some really amazing partnerships that came forward. And I think we really learned to put the right people in the room and leverage strengths in a creative way. So the Department of Transportation, which is a phenomenal resource in terms of logistics and has not the capacity to work all over the state because they already work across the entire state. And they helped us from a logistics and distribution. We partnered with private industry as well. Brooklyn Bedding, actually, they took their folks that were making mattresses and they started making masks. And we started getting those out to employees. We worked with the Arizona Correctional Industries, and they already made clothing and that was used for inmates. And so they were able to say, hey, we can make masks too. And so our inmate workers were able to contribute to the safety of our employees in state service. And so also at Fabric, which is a local organization in Tempe, they stepped up and said, hey, we have machines that can cut fabric really, really quickly. So I remember one day I got a call, okay, ADOT's driving the fabric and they're picking it up here and they're taking it over to Fabric. It'll be cut there. And then they're going to drive it over to Corrections and they're going to sew it. And then we're going to drive it and then the agencies will pick it up and they'll get it to their staff tomorrow morning. Just a logistics miracle. I actually got a picture. Somebody sent me a picture of, hey, DCS picked up their masks. And I looked and the picture was Robert Navarro, who is a Flinn Fellow, and he's on this call. And it was him with this bag of masks. And so, I think there's a lot of stories like that where Flinn Fellows all over really stepped up to serve. As a result, we ended up producing and purchasing over 83,000 fabric masks. 65,000 went to state agencies, to employees, and over 18,000 went to schools and charter schools. That was a big success. And then lastly, one of the, I think, biggest challenges and one of the most rewarding projects that I got to work on over the last few months was the Arizona enrichment centers. And so the problem that we faced was essential workers needed access to childcare when schools were closed, and when many childcare facilities as well had closed. So we had a policy solution, a budget solution to provide childcare using federal funding through the CARES Act. But the challenge was, okay, well, how do we stand this up ASAP? And so again, we said, okay, well, who are the subject matter experts that we need? We got some wonderful project managers in the room, and everyone just stepped up. It didn't matter what your job was. We were all there. We had a singular goal, and Richie was a part of that team. This is a partnership between the Department of Education, our office, ADOA, which is the Department of Administration, Economic Security, and I'm leaving out a few. And so we were able, again, to leverage the network of resources that already existed by using the pre-existing network of childcare providers through the Department of Economic Security. The work that the team did was amazing. And for the first few weeks, we met twice a day and often spent many weekends. And in a matter of days, we had a website and people were able to apply, be approved for childcare, and then go and take their child to a facility that was following guidelines provided by the Department of Health Services, so that they could go to work and serve our citizens when we needed it most. In the end, we were able to serve over 11,000 children and over 6,000 families. And of those, almost 5,000 qualified for scholarships. So just an amazing, I think, success from my standpoint, and really, again, speaks to just the service and the willingness to step up from our team. So I could go on, but I'm going to stop now. So thank you.
Thank you, Sarah. Appreciate that. And the Arizona Enrichment Centers, I think, is one of the untold success stories of state government in the response to COVID-19, and that were leveraged across Flinn-Brown fellows. I know that made the conversations a lot easier to have because so many of us were familiar with one another. A partner in that effort was Richie Taylor. Now, everyone on the screen, I think, has something in common, that they work for the governor's office or part of the governor's administration in a cabinet agency. Richie Taylor works for Superintendent of Public Instruction, Kathy Hoffman, for the Department of Education. He's the communications director. And he's really, I think, been a partner to us in our office, and his office has been a partner throughout this pandemic. We don't agree on everything. Our bosses don't agree on everything, but we know that we can pick the phone up at the end of the day and we can vent about how difficult things were, and we could talk about what we could do together to serve the people of the state. And I think that's another example of the importance of organizations like the Flinn Foundation and the Arizona Center for Civic Leadership. With that, I want to pass it over to Richie Taylor to hear his story.
Thank you, Daniel. Yes, I come at this a little bit of a different, from a different place, working for a different elected leader, but it's something that Superintendent Hoffman has stressed prior to the pandemic and throughout, that she ran for this office and wants to lead the Department of Education in a way that that does collaborate and does work together with other state agencies, because the work that we do through the Department of Education touches so many lives and is so important, and it is critical even when we don't agree on policy or on the direction, that we do find a way to work with the governor's office and with our state agency partners. And prior to the COVID-19 pandemic, we of course worked with DHS and DCS occasionally here and there, but since March it's been weekly, daily, sometimes more than a few times a day, as we work together to meet the needs of schools and the communities that they serve. So I just want to take you through and kind of walk through all of the stuff that's happened in education since March and how that has gone. In March, as schools began to close, not just in Arizona, but across the nation, we realized that there was a need probably for a more uniform approach. There was so much unknown at that time about the virus and what its impact would be on schools. And so the governor and the superintendent, as we mentioned previously, made the decision to close schools statewide. And initially it was just for, I think, a couple of weeks at that time. We then extended it another time. And then at that point we knew, the school year was probably, was just a few weeks away anyway, the end of it. And so we needed to just finish it out and focus on what it would look like to reopen schools and what schools and students needed during that time of school closures. And as Sarah mentioned, the enrichment centers was one of the things that we worked really quickly on and closely on to meet the needs of those essential workers when school buildings were closed and distance learning was happening. Another thing that's really critical that I know people have heard about, but the really essential service that schools often provide is food and nutrition services. And so we worked really closely with our federal partners to gain USDA waivers so that schools could begin operating their summer food service programs, which allows grab and go meals to be taken and picked up. There's a lot more flexibility than the regular in-person delivery of meals. And over the course of the pandemic, schools have stepped up and provided nutrition services, not just to the students that are enrolled there, but anyone who comes that is under 18 that needs a meal. And they've served millions and millions, probably over tens of millions of meals to students and families. And that's been a critical service that schools have provided throughout the pandemic, whether their buildings are physically open or closed. One of the first things after the initial March closure that we wanted to focus on was there was going to be a need for school closure legislation to finish out the school year remotely and provide continuity of pay to educators and staff who are now working remotely as well, rather than in the schools. And so we convened a group of stakeholders, including education leaders, state legislators, and others to develop that, to work with the legislature to develop those that legislation to close schools, finish the year, and provide that continuity of pay. And I think one of the big wins back then was that the legislature passed that unanimously, I think, and we were able to finish the school year in a way that provided stability to families and employees of those schools pretty quickly. And I think that experience showed that when there is a crisis, we can come together quickly and focus on solutions and do what needs to be done to help serve the people in our state. After that, and after the school year wrapped up, we began quickly to focus on what the new school year would look like and what reopening schools would take. And so we developed the Roadmap to Reopening Task Force to develop policies and solutions that local school leaders could use to implement their own plans for reopening. We developed scenarios for learning based on the path of the pandemic, which was unknown, is still ongoing, but for where the virus was based on what was happening in those scenarios that would be needed to meet the needs of students. We worked really closely with people from across the spectrum, school leaders, educators, legislators. There was over 100 people on that task force that developed the initial roadmap, bringing in the guidance from the federal government, working with DHS and public health experts to inform those decisions. Everything from attendance taking methods and school finance recommendations. It really came together pretty quickly, but that was because of the effort of so many people from across the state and across the education spectrum that allowed that to happen. And it helped guide those decisions at the local level. One of the critical asks that school leaders had, in addition to the guidance that would help them reopen their schools, was for public health data that would help them inform when it was safe or safer to open and under what conditions. And so we worked really closely with the Department of Health Services and the governor's office to develop those policies. And Arizona was one of the first states to set such criteria, which are now known as the benchmarks, based on what was happening with the virus, and those are still in use. Schools still look to them every day. We wait for the data on Thursdays to drop to show what decisions will need to be made at the local level. We also worked throughout that time to communicate all of these changes to schools. There's a flurry of information, and my job as communications director before the pandemic was much different. I largely talked to the media and was much more external facing, and now there was much more of a need for consistent and clear communication throughout this process so that schools had all of the information they needed to do their jobs. And that's really the work of the department. We don't operate schools ourselves. We provide the guidance and help for local school districts and charter schools to do that. So throughout this process, what we've really tried to focus on and make our guiding principle is collaboration, is working together, is coming to find those solutions with people we don't always agree with, but we've always been better served when we have been able to bring together a group of stakeholders and get their input and develop solutions and policy positions when there is that broad stakeholder input and engagement. And I think that really is the theme that has run through all of this work in the pandemic, is that we really do work, things turn out better when we all work together to get there. And I think as a person who's new to the Flinn-Brown Fellowship, you know, I actually was interviewing for my cohort during the middle of the summer, during the height of everything. And I think I have learned pretty quickly how valuable those relationships are. And I'm really happy to be a part of this program, and looking forward to next year when I really get to experience the full Flinn-Brown experience. But knowing that there were Flinn-Brown fellows who were doing this work really kind of helped ease the transition and relationships that needed to be built to get to the right place policy-wise.
Thank you, Richie, and thanks again for all your continued partnership and help throughout this. We really appreciate having you as an ally in serving Arizonans. Next, I want to hear from Ben Blink, who is a policy advisor to the governor and advises on everything from IT and innovation to transportation to something that's really been at the forefront this year, municipal affairs. He was integral in creating our CARES Act distribution for local governments and has worked closely with them. I'd like to hear from Ben Blink next.
Thanks so much, Daniel. And it's really a pleasure to be a part of this panel with this group. March 10th is a really big day in my mind because I was testifying before a House committee with Flinn Fellow Paul Brierley about the importance of rural broadband internet. And we were talking about, you know, the importance for rural agriculture and the importance for economic development in rural areas, projects that we've been working on for multiple years, waiting for kind of legislative authorization at that time. And at that afternoon, the next day was when Governor Ducey issued his emergency declaration around COVID-19. And COVID had definitely been part of the conversation and something we've all been thinking about, but that was coming out of that committee room was a very different environment than I think when we both walked into it, because all of the work after that really shifted from anything we had been working on at that point to exclusively the COVID-19 response. And, you know, I think the legislative work at that point had basically stopped. The legislature, you know, basically ended their session, and then we were kind of full force response to that. So I come at it from a very different angle than Jessica and Sarah and others who are really focused on the public health response. My responsibility was mostly around the economic response and what we're doing for businesses and others who are suffering during COVID-19. So I think the initial focus that we had on our side was knowing that large federal stimulus was likely coming down the pike. You know, what are the gaps going to be? Where does the state need to step in? How best can we help? Given the uncertainty of what federal legislation was coming down. So I think in addition to kind of that larger, bigger strategic thinking, it was basically putting on our hats and saying, okay, what sphere of influence do we have with our state agencies and what areas do we impact, even the smallest things that we can do to help with the response. So one thing that comes to mind early on, there were huge concerns about supply chain for basic supplies and food to all of our grocery stores. So, okay, I work with the Department of Transportation, what can we do? So the first thing we did was we ensured that, you know, we looked at the weight limits of trucks that are allowed on the interstates, those weight limits are mostly in place to ensure that trucks don't cause more outsized damage to the roads than they normally would. Well, our concerns became much less about road damage and much more about getting supplies where they needed to be. So we shifted we increased the weight limit so they can carry more supplies to critical services. An important but somewhat obscure law prohibits the sale of food at our state rest areas. With many restaurants shutting down and capacity around certain fast food places in question, we needed to make sure that trucks could stay on the road and get food while, you know, obviously be fed as they're driving. So we issued an executive order to make sure food trucks could station up at those rest areas to make sure our, you know, the drivers who are driving our critical supplies can stop and get food and continue on their way. So little things like that were really kind of critical early on. In addition to some of those changes, a lot of what we do is just looking at our sphere of influence and having discussions with the right people to make sure that we can respond in the best way possible. So the governor met with utilities and with internet providers and set really firm expectations that in this time of crisis, when people are losing their jobs, they don't have their utilities shut off and their internet shut down. And we were really impressed to see how those companies responded to provide low-cost services and to put relief and delay in some of those collections. That was really, really critical going on. In addition to that, I'm a policy advisor, but we were all hands on deck for our operations as well. Sarah did and Daniel have done phenomenal work at all of our state agencies, really shifting their mode of operations to serve customers during this. And we're looking at our MVD operations at this time. We have the best run MVD offices in the country in normal times for sure, but MVD offices are not known for physical distancing when you're inside of them. So shifting that operation largely online into phones, tremendous challenge and incredible work by our directors. Obviously, challenges persist in those types of things, but really what was accomplished to take really tremendous challenges and run with those and get work done has been very incredible. So, a lot of small things early on, and then I think as we got more clarity about what the federal response looked like, and as CARES Act monies began to be distributed to the states and to see where the Paycheck Protection Program and other federal programs were coming in, we looked to see what can we do with our state dollars to have the biggest impact. So just looking at the numbers, Arizona is a state that relies heavily on tourism. Tourism heavily hit in Arizona, and the types of businesses, the small restaurants, other gyms, movie theaters, the places that have the highest capacity for COVID-19 spread, that paused their operations during the emergency, we really went all hands on deck to help them the best we could. So, we partnered with Local First Arizona, which Local First has done great work in Arizona for a long time. They've got connections to our office, and we've worked with them a lot. But it was through a Flinn-Brown connection that I was working with Thomas Barr over there and their team that helped us. They became our partner in distributing 10 million state dollars to provide rent and mortgage relief to those restaurants, bars, and gyms that were shut down. And they were really doing the heavy lifting on a lot of that. So we were really grateful for that. And I was grateful for the Flinn-Brown network for helping to broker that partnership there. We've also been working a lot with restaurants on just other things that we can do to help them safely expand their services. So making sure they can serve outside, and with large, voluminous state code and rules, there's always things that can get in the way of doing that as efficiently, as quickly as possible. So we continue to look for and implement strategies to help restaurants, serve outside safely to their customers in the best way possible. So that definitely remains a focus. The other thing I want to call out is work with local governments as well. So in addition to my policy work, one of my lists in my policy areas is working on local government affairs. And in normal times, what that looks like is, if there are bills that come through the legislature that have an impact on local governments, then those would typically be directed at me to do the analysis on that. That role shifted a lot during this time. I became the point of contact for the mayors of our 91 cities and towns and the 61 county supervisors who serve Arizona. So they all have my cell phone number, and with all the uncertainty happening, amid the pandemic, lots of work with them and incredible partnership, incredible work that they've been doing as well. One thing that we heard from them, is they were certainly cash strapped and awaiting funding from federal funding to flow through the state and to them, as they wanted maximum flexibility as possible with those dollars. So I have to give a big shout out to our economic recovery management team within our budget office here, experts in federal grants and resources who've done exceptional work through this, but in partnership with them, and they really did the bulk of the lifting in designing a program that gave cities and towns maximum flexibility with the allocations that they received. So what that meant is that we have 91 cities and towns who've been implementing their own small business programs, who've been giving grants to theaters and stages so that they can get assistance to stay open. And providing that flexibility and making sure that we made it as easy as possible for them to get those dollars to help them navigate the federal rules, which are extensive for those monies, that they can get those directed in the areas in their communities where they need it most. So we've been extremely grateful for that partnership and the mayors and their staff that we work with every single day on that front. And I think, as I think back to the work that's been done so far, and we're certainly, not at the finish line on this yet, and are continuing to work long hours and work hard on this, I'm just extremely grateful for folks like, from the Flinn-Brown network. I've worked really closely with Yuma County Supervisor Russell McLeod, who I've sat next to during our Flinn-Brown sessions, and he was the head of the County Supervisors Association. Extremely helpful counsel on a lot of this. Staff throughout all levels of government, And yeah, I'm so grateful for this network and what it's done, I think, to really improve our state response and our collaboration to do the best that we can in these extremely challenging times. So thanks so much.
Thank you, Ben. And I think Ben just gave a few more examples of just how important this network is. He also said something about the fact that we're not out of this crisis. I think we're all facing a number of issues still with the rise in cases. And we're all beaming, I think, with pride about some of the accomplishments we have, but we know that we have a lot of work ahead of us. So that was an important reminder that stuck out to me in Ben's remarks, and we can touch on that in just a bit. Next, I want to hear from Alec Esteban Thompson, who was the executive director of the Arizona Complete Count Committee. That was the committee that was charged with ensuring that everyone was counted during our census. Obviously, that was a little bit more difficult this year as we dealt with the COVID-19 pandemic. He also serves as the Director of Strategic Initiatives and Campaigns for the Governor's Office and was integral in establishing the Arizona Together website, those volunteer efforts, and working with the business community on some of the efforts they could do to support everyday Arizonans in need. So with that, I want to hand it over to Alec.
Well, thanks so much, Daniel. You know, I just sitting here, I'm so impressed by everyone. And even I'm learning things about some of the work that has been done on the state level. But I think it's just so valuable to have just that immediate common ground with Flinn-Brown Fellows when you're getting to work, just in terms of getting things done faster and getting them done the right way. So, you know, I think since I've joined the administration 3 years ago, in the Arizona-Mexico Commission, my job description certainly did not include public health campaigns. I've always been somewhat of a generalist for the office, though, you know, jumping in when there's support needed at an event or communications needs, which tends to kind of be my focus area, but definitely never public health campaigns. But, you know, I vividly remember, as everyone kind of remembers, you know, when Michael Jackson died, when whatever, all these different moments, right, in pop culture. Well, I remember when COVID was real. And I remember sitting in the office when the governor signed the emergency declaration and, you know, seeing these leaders from ACA and AOT and all of the different state agencies really brainstorm how they were going to take care of their respective industries of Arizonans and the workforce, et cetera. And everyone was coming up with all these different resources. And you know, I just remember thinking, this is so overwhelming for me. I can't imagine having just lost my job and having to search around, you know, the internet for unemployment insurance, and then what APS is offering in terms of support. And so, you know, I came together, I talked to Daniel and I said, hey, we need to streamline this. We need a centralized source for resources related to COVID. And he was totally on board and he, you know, helped grow it and suggested that we added a volunteerism piece. So actually, we reached out to a Flinn-Brown fellow who has since left the state and now works for Governor Polis in Colorado. And another great example of collaborating from the Flinn-Brown front, we modeled our volunteer effort after theirs, which was really great. And we also added the philanthropy piece, which is the Arizona Coronavirus Relief Fund. So the Arizona Together brand really became something huge. It became something that I never imagined that I would be working on. Census did continue, for the record, and we did really well. I'll touch on that in a little bit, but it became my whole world, and I just became truly obsessed, I think, and along with a lot of others, just totally tunnel vision on what needed to be done and how we could best do it to make people's lives even slightly better. Because I know there was just so much struggle for everyone during this time. But to date, the site itself has had a little over 1 million visits since Governor Ducey launched it on March 23rd. We've expanded it substantially, so now it serves as a state's hub for all grants, both that come from the CARES Act money, as well as state grants. And, you know, we are sharing community support stories, even ways to stay healthy and active at home. And I think the Arizona Together, you know, Daniel and I always talk about this now, how it became kind of the brand for the state's COVID response. And I think it's a really great message because truly everyone came together to have an impact. And, be it, state agencies, state employees, the private sector, to really just get to work and, get things done for Arizonans. I know a few that are not on the panel who did great work. Anna Haney, I know she responded for this. She's leading the state's grants effort. Ben Henderson, I mentioned him. But really, the way that the community came together, I mean, my phone was ringing off the hook of people that wanted to be listed on this website to offer everything from domestic violence assistance, which the calls were increasing substantially, to food assistance programs. I remember, working with Richie to get the school lunch sites listed, and it was just truly incredible to see how everyone came together. And a really great story of that is that I had the pleasure of working on was the state's Mask Up campaign. And so we had some of the state's leaders in advertising come together and commit to donating thousands of hours, literally thousands of hours, to develop creative concepts that were going to promote and normalize the use of masks in the state. I think we saw how politicized this was, but I think we did some really great work to mitigate some of that messaging. And through over 310 million impressions, so huge reach that we had. We were able to really connect with Arizonans and use a little bit more friendly messaging in some cases, some more startling messaging in other cases, and then just a general Arizona message. This is about protecting Arizonans. And so we came up with a really great campaign. I encourage everyone to check out some of the samples of that advertising content developed by our agency partners that's featured on the website. But I mean, these business leaders, these advertising agencies donated so much time. And this is just one example. I worked with Sarah on another example to get IKEA to donate a bunch of supplies to the, oh God, I'm blanking on the name, Sarah, the program where we provided childcare for first responders. And so IKEA donated a bunch of supplies to make those spaces more inviting and really extra special for these children whose parents were taking care of us. So just before I wrap up, Daniel wanted me to talk about census because it was a very successful one for Arizona. Despite unprecedented challenges, we did beat our response rates from the last 2 decades. And 99.9% of Arizona households were enumerated. So this is really big news for us. And, it actually does kind of tie into this conversation because the way that the money that Ben was talking about earlier was distributed was in large part based on census numbers. So that I think it just is a reminder of how important it is to get that complete and accurate count. And, I think we're on track to, definitely reflect the population growth that our state has seen, the increasing diversity of our state in the 2020 census, and hopefully, a 10th congressional seat. So really exciting stuff. But I think just generally, I'm just so impressed by everyone, the way that the community came together, the 1,600 plus volunteers that we've registered through Arizona Together, the way that we both through the state, the cities, the way that our state has come together. And I think it's a good conversation to have within the Flinn-Brown network, because that's exactly what we preach. It's exactly what we come together for as a network, is to really work across sectors, across parties, to get things done in the right way for our state. So anyway, thank you.
Thank you, Alec. The IKEA donation was for the Arizona Enrichment Centers.
Thank you.
Yeah, that whole campaign through Arizona Together, I think really it was built on community involvement. And it's something that we do owe our former colleague and friend who's actually on the call, a great deal of for the inspiration, and that's Ben Henderson, who's now serving Governor Polis. We were always inspired by Ben when he worked here, and we're still inspired today. Now I kind of want to just have an open discussion with you all, and feel free to type in any questions that you have. But I want to just start by asking about your interest in the Flinn-Brown program. You're all Flinn-Brown fellows. What made you want to participate? Anyone want to go first?
I'll go first as the newest member. I knew that I was already working in state government, but I definitely saw the benefit in joining a network and an organization that really focused on service and wanted to and help people do their jobs better by making those connections. And so that was the impetus for me joining.
Awesome.
Go ahead, Jessica. Sorry.
Sorry, Ben, thank you. No, on my end, my career-long passion has been health and health policy and protecting the health of the citizens or communities that I'm serving. And I felt like I was at this point where in order to do a good job of that, I needed to understand the broader context of policy and the other sectors that were operating in government, so I could make sure that the things that I was looking at prioritizing were in alignment with what else was going on in that broader context of governing. And so I felt like Flinn-Brown was a perfect opportunity to kind of look at all of those different sectors and connect with those individuals to have a better, more comprehensive view of what that would look like.
Yeah, and for me, I knew that state government was a space that I wanted to work in. I tried at the federal side a little bit and at the local side, and really found the sweet spot in state government. And I was incredibly lucky because I was a relatively new Arizona transplant when I was in Flinn-Brown. And I'm just incredibly grateful for the experience, because I think now when I look at my primary friend group, all Flinn-Brown folks, and just the connections across state government, it's a complete accelerator to connections and other people to really thrive in state, local government in Arizona.
I think Flinn-Brown has really developed a reputation as being the model leadership program for the state. And so I just knew, having been in public service at the city level, I knew that it was a great step to take. And I was highly encouraged by people I look up to, including Daniel Juan Ciscomani, who is my former boss, to take that step and get engaged in that network. And it's paid off ever since. So.
Yeah, and I would say similar to Ben, I grew up in the budget office, as Tom Betlack would say, and that's when I applied and went through the Flinn-Brown program. And I really was seeking an experience to understand and better see the diversity of perspectives and work that was happening in the public sector space of Arizona, instead of just that lens of the budget, which is an awesome framework, but I knew, okay, there's more out there. And I definitely came away with a deeper, I think, real appreciation for just the diversity of thought and leadership in Arizona.
Thank you, Sarah. We have a question from one of the participants. JP asked, he said, thank you to all of our FB panelists. So grateful for your time and insight. The governor's office was agile in modernizing government services to adapt to the pandemic. Through executive action, telehealth, and e-notary services, they've made essential operations safe and effective. Will they expire? Must we go back to pen and paper systems? And I think this is probably a question for Ben Blink or Sarah Prezada. We are looking at ways that we can extend these services, right, Ben?
Oh, absolutely. And I think a lot of the executive orders that have come through are, temporary. They're executive orders, and they require, in response to the public health emergency, and to implement them long-term, they require legislative action. And those are definitely things on the policy side we're looking at, because we've learned a lot about what we can do. I'll say the shift from pen and paper is not new to COVID-19, but the emergency has demonstrated how important it really is. So those efforts certainly won't stop, and we've got a lot happening behind the scenes at our Department of Administration to make sure that we get as many services online and as many processes online as we possibly can.
Anything to add there, Sarah?
I would just add that, there's been a lot of studies on consumer behavior, and I think we're seeing consumer behavior change, and those expectations aren't going to change back especially around those electronic services and telehealth. And while in state government, consumer behavior hasn't always been at that pace of wanting electronic services, I think now it's here. It's been a catalyst, and that's not going to change. So we need to adapt accordingly.
Thank you, Sarah. We also have a question from Norman Umberger, and I'll take this one. He says, curious if there will be a debrief scheduled after we get through the crisis. I see a long list of opportunities for improvement across the state and at other levels in government. It would be nice to get some course corrections done now to shorten the crisis. And Norman, absolutely. I think we were all aware on this call that we are nowhere near the end of this. We all have a lot of work ahead of us. The COVID-19 response will continue. And so rather than waiting for a post-crisis debrief, we're actually in the midst of that now, working with our agency directors to kind of create a guidebook on the response, what went well, what didn't go so well, what we would like to improve on. We've had a focus on continuous improvement and measuring the efficacy, the productivity of our work. That's become even more important now. So I would say, yes, it probably isn't going to be a one debrief after the crisis. It's going to be an ongoing conversation that we will have. And certainly we would invite feedback and anyone that wants to be a part of the solution. We would love to have that voice in the mix. So please don't hesitate to reach out. The next question I have is from Blake Sacha, who says, given the recent surge in cases, what do you see as the critical policy needs between now and vaccine immunity? Now, the governor will be making an announcement today in about 15 minutes. He's holding a press conference with Dr. Christ and General McGuire and a few other special guests, where we are going to be talking about some of our policy initiatives to mitigate the spread of COVID-19. One of the things that we did earlier this year was we put together a really strict list of mitigation requirements that we require of our businesses. Our gyms are operating at 25% capacity. We've reduced capacity in our restaurants. Bars are closed unless they're operating as restaurants. And so there are a number of things that we still have in place that we want to make sure are really being enforced. The idea that gatherings over 50 are prohibited, that's still very much the reality here in Arizona. That's the policy. And we can only allow those if an exemption has been granted by local jurisdictions. We want to make sure that we are doing everything we can to enforce those requirements, that we are enforcing the mitigation requirements at those events if they are approved. And so I would look towards today's press conference for an idea of our goals there, an idea of what we're going to do to encourage decreased capacity in our restaurants. We are going to continue to look at every option available. You mentioned the vaccine. We are in the stages, I think, of this pandemic where there's a little bit of a bridge. There does seem to be a light at the end of the tunnel with this vaccine, but we're not there yet. We know we're not there yet. We can't go back to normal as much as I think we'd all like to get back to normal. So we are working to communicate what that bridge looks like until we are in a place where we have herd immunity, where the vaccination is available to wide parts of the community. And Jessica Rigler is working with the Department of Health Services, and I know that she and Dr. Christ will be announcing more details around our vaccination plan later this week. Anything to add there, Jessica?
No, I think that was a great summary. We keep our eye on the prize of that vaccine, but there's still work to be done on partnering with all of our citizens and mitigation while we get there.
Thank you. And there's a lot of people, I'm sure, on this call that are part of the Flinn-Brown network as well, that are going to be integral to the vaccine, the success of the vaccine, messaging it to the different community members. And Jessica's team has been convening folks across the spectrum on that. We have about 11 more minutes before we end and before the governor's press conference starts. I want to just touch on something that Alec mentioned, and he mentioned the Mask Up campaign. And, that's something that we had a lot of business community members really working toward, that was designed to appeal to people that weren't wearing masks, people that just wanted to go to a baseball game. They didn't want to wear a mask. We wanted to communicate why it was important to wear a mask. And one of our ad agencies came up with a campaign that gained a little bit of criticism from members of the media, from some folks that weren't the target audience. And I think it really is an example of people with good intentions. In this case, it was one of our best advertising agencies in the state, really trying to help and do their part, and that quickly became politicized. A lot of the work that's taking place in public service right now is politicized, and we can't defend every policy that is in place by the federal government, by the state government. We can just do our best to ensure that we're operating efficiently, that we're doing our part to make things better. I want to ask before we end, understanding that these are really these are good jobs because they're fulfilling jobs, that there's work, there's value in all of this work, there's purpose in all of this work. But how do you all deal with some of the criticism that you'll get at the end of the day after serving during these really difficult times? Start with Jessica.
Yeah, I'll tell you, we have these conversations internally all the time. It feels like the weight of the world is on your shoulders. And so it's a constant discussion with our teams, and something that I talk about with my family even too, that we have only so much that we can implement. And if we continue to focus on our goal, which is to provide the best service that we can to the people of Arizona, and can feel comfortable that we're doing that, then we can, go home and sleep at the end of the day. And I think everyone has an opinion, and it's hard because not everyone sees the full picture, the full spectrum of what we're working on. And so we continue to come back to what good have we done for public health today, or this week, or this year, or this month. And one of the examples I look at from the summer surge is that we saw a surge in community cases, but we saw a very level number of cases in our long-term care and assisted living facilities. And that was a testament to the very hard work of public health to reach out to those facilities, to offer that technical assistance, to go in and support. And so constantly trying to pull those examples of where we really truly have made a difference, because it's hard with the criticism coming in a lot of the time to keep that in perspective, that we really are doing the best that we can to be in service to the people of Arizona.
Thanks, Jessica. Anyone else want to touch on that topic?
I would like to. It is difficult to receive criticism, especially I think if it's valid. It does, but there's an opportunity there, I think, when you do receive criticism to maybe correct and change course, or do something differently, or communicate it better. So I try to take criticism that I get, or that the agency gets, or my boss gets, and then do better going forward.
Yeah, I'll jump in as well. I'll say first off, none of us stand in front of the public and take their criticism directly. And I think it goes a long way to have leaders that stand up and do that. And I'm always humbled and grateful for that. That's a really, really hard job. I think personally, a tool that I use, especially when there's so much going on and so much outside of our control, and really just having that focus and asking myself, what's in my control, what's in my influence, and then what's outside of my sphere of influence and control. And okay, well, I'm going to focus on the things in my control. And if I do that every day, it's usually a good day.
I think I think it's coming from a very liberal family and having worked for elected officials on both sides of the aisle, there's never a shortage of, questions about what's happening or how I can get through the day. And I can't even imagine what it must be like, for Jessica or Dr. Christ or the governor, because they are public facing. But I think it is challenging on a personal level to get those kinds of messages, but work through them and be able to see, kind of what Sarah talked about, the impact that you're actually having and the impact that everyone on this panel is having. So sometimes, I'll be feeling something that is sparked by a comment of criticism, but then I'll, go into Daniel's office and have a conversation about something that just gets me totally inspired. And so I think it's about, taking those for face value and not getting overly emotional about criticism, and just staying focused, like Sarah said, on the end goal and the impact that we're actually having.
Ben, anything to add?
Yeah, I think early in the pandemic, one of my duties was to give a conference call update to all the mayors and supervisors every day, separate conference calls, and then take their questions at the end. And especially early in the pandemic, we didn't have all the answers. There was a lot of work that was happening, but the questions they were asking were good ones, but there was a lot of work yet to do. And I remember the first public reporting, I think, of my name in the press in Arizona was about how unhelpful I was in answering questions on these conference calls. But I think seeing the work that was happening behind the scenes and just how much good work there was happening and how much progress we were making over that period of time helped arm myself against some of those criticisms, knowing what we were up against and what we were trying to accomplish, and being around great colleagues and people who were supportive was always extremely helpful. And having, of course, the support of your boss through those some of those challenging publicly facing moments is always helpful too.
Yeah, Sarah mentioned that it's nice to have bosses that are willing to stand up and take the arrows, and I think that all of us have that example of leadership. Whether it's our office with the governor, whether it's Dr. Christ with the Department of Health Services that Jessica has, that whether it's the superintendent of public instruction, Kathy Hoffman, they've all stood up and they've taken the criticism and they've listened to it. And I think they've listened to it in a way that is constructive. They want to hear how the public is going to react to some of these policies. They want to see if there's an opportunity to adjust, to improve. And so I think we're all lucky to work for leaders like that. I think everyone here is certainly interested in public services. I know that everyone participating is likely a leader in their own community. And I want to thank you all for joining the call today. And I want to just make an ask of you. As I mentioned, we are not through this pandemic. We are seeing rising case numbers. The demand in our hospitals has increased. And we're seeing a higher percent positivity in our communities, in our hospitals. We really need your help. We need everyone in the community to be a messenger of some of the good practices we know will work to mitigate the spread. Wearing a mask, staying home when you're sick. Actually, staying home is the safest place to be, especially if you're a member of a vulnerable community. Ensuring that people are practicing physical distancing and keeping their gatherings to a minimum. These are all things that are very trying, and they're not easy asks to make of Arizonans. There are some people that listen to the governor's press conference and they listen to Dr. Chris and they're able to make those changes. They listen to their local leaders and they're able to make those changes in their everyday lives. But others, they just want to hear from their friends. They want to hear from the people they trust. They want to hear from the people they know are committed to making Arizona a better place. So we need your help. Please message those things. Please message the importance of some of these steps to keep our community safe. And we are all here at your disposal. We want to be available. We want to hear from you some of the feedback that you have. We want to be able to improve things as much as we possibly can. So don't hesitate to reach out if you have any ideas on how things can improve or opportunities where we can create a government that works better for the people. With that, I'm going to end the call. I want to thank Don Wallace, Sarah Larson, and Chris Farrington from the Arizona Center for Civic Leadership, and everyone on the Flinn Foundation for giving us this platform today. And I want to thank you all for joining us. The governor's press conference will start in about 2 minutes. If you're interested, you can watch on his Facebook page on Facebook Live. Thank you and have a great evening.